And I definitely think that like the newer innovations, whether it's new players like Amazon or Walmart or CVS or new technology companies, they're really having a massive disruption in the healthcare industry. Um, and it's affecting a lot of people. Do you think that the like for example, Walmart and CVS, um, do you think that they're going to grow to a point where they compete with the existing model of a traditional hospital or a traditional clinic? Do you think people are going to go to Walmart to receive their healthcare services as compared to a clinic or a hospital? Is that going to be the new normal or the shift when it comes to healthcare?
I think when you say hospital, you really, hospitals provide a broad array of services. Obviously, inpatient, med surg, acute care, surgeries, and very high-end tertiary care. Uh, I don't think, Walmart and some of these others have an interest in replicating those type services. I do think they will play a very active role in many of the services that are now being provided on an outpatient basis, and they're doing it. Walmart continues to open up clinics throughout the country, and other organizations are doing likewise. And so I think the competition that a traditional hospital or health system will face will be a different level of competition. Those companies like Walmart and others bring a lot of expertise. They also bring a lot of capital at their disposal to deal with new ventures that they want to get into. Hospitals, on the other hand, are continuing to face challenges on income and keeping a large hospital or health system viable. You need the cash, you need the financial wherewithal to do that. And so it's going to be interesting to see what happens. I don't think hospitals are going to go away. They're going to continue, I think, to consolidate, but they're going to face new and varied forms of competition. And it's going to require hospitals become more nimble to the market and what the market expects.
Mhm. And I also feel that a lot of like especially during this time, a lot of rural hospitals I've seen in news reports are closing down, and that really poses an issue of the care that small communities
Mhm.
receive, especially because it can be a devastating blow to people of the resident of the community, both financially speaking, because they potentially could have lost their job, and then also too, they've lost uh, their healthcare, their line to healthcare service. So the healthcare access gap becomes wider. What do you, as far as independent hospitals or small rural community clinics go, what do you think is the viable solution in terms of keeping them either afloat financially? Is it like should they be looking for mergers and partnerships with larger healthcare systems, or how do they sustain themselves going forward?
I mean, it's a complicated question. I wish I knew the answer. I don't. If I did, I probably wouldn't be talking to you right now. I'd be on a yacht somewhere enjoying some great benefits of coming up with that solution. But I do know firsthand how important those rural healthcare services are. I saw it. I saw people's lives that were saved because they had access to an emergency room. Now, in many cases, the patient that came to the emergency room, we were able to stabilize them, but then we would transport them to another larger facility if their care wasn't being able to be provided at the rural hospital that I was at. And so you see this situation unfolding. I saw an article today, I believe since 2010, I read 138 hospitals have closed across the nation, many of those in rural areas. And so you've got to ask, would you go to a rural community without a hospital or without adequate healthcare services? I could ask, would you go to a rural community without fire protection, without police protection? Healthcare is vital to those rural areas. And so there's going to be changes. I don't think there's a single component solution. There's a multiple facet approach. Telemedicine can play a role. There are other, ways of using different practitioners, maybe, nurse practitioners, if you're not able to recruit physicians to the rural community. And that's a challenge. There's a shortage of physicians right now that most indicators that they're going to continue to be, if not even get worse. And the rural communities find that challenging. So I don't know the solution. I think it will be a combination of things, everything from smaller facilities affiliating with bigger organizations. The old adage, their strength in numbers. Well, I think that can play out and is true in many respects in the rural communities. I saw that play out during my tenure with Baptist on their administrative team, how some of those hospitals that became affiliated with Baptist were facing pretty tough situation. And through the Baptist organization, they were able to, stabilize and sustain that hospital. And in many cases, even grow the hospital, provide new services, provide new facilities. And so it's not a one size fit all solution. It takes everything from the local citizens, the local government, to work to make it happen.
Mhm. Yeah, it's definitely a tricky issue. And I also feel that a lot of uh, people in rural areas, they're moving out of rural areas. So that makes it tricky in terms of you have a decreasing population in rural areas and you have it's hard to get healthcare providers to go into rural areas. Those two things combined is a very tricky situation.
It is, and I mean, I loved my time in the rural communities where I participated. Wonderful relationships developed, but rural communities face, not only the healthcare industry, but in many cases, a loss of industrial jobs. Whether various plants that were based in rural communities have shut down, and those jobs have gone elsewhere. And so when that happens, that has a profound impact on the community, not just in the healthcare part of that community, but other businesses who want customers to come and buy products and services. Well, if there are no jobs, people tend to leave. And so rural America is really a challenging time right now.